This government meeting is brought to you by Eastworks and our local cable subscribers.
Then I would like to make a motion to start today's Board of Health meeting on September 10th, 2024 at 5:32 p.m.
Steve, technically,
I will second.
yeah, there you go. And then all in favor?
Aye.
Beth, yes.
Steve,
Yes.
just because we're remote to follow the Attorney General's law, we have to state our name and then yes.
Steve, yes.
Amy, yes. All right. So I will start this meeting with our opening remarks. In accordance with Massachusetts general law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you'd like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or topic for later discussion via email at health@easthamptonma.gov email address. All right, so with that taken care of, let me open the agenda again. Hold on. There, the box. Hold on, sorry guys. Some reason my Gmail closed with the agenda in it. So, is there anybody here for public speak? Let's start there. No one's here for public speak. Then we will move to the next item on the agenda, which is...
Amy, I can have mine open if you need me to look at it.
I got it. Thank you.
Okay.
Approval of, I just got it. Approval of meeting minutes. So the minutes from 7/10/24. Beth?
Yes, I reviewed the minutes and I have no concerns or questions.
You want to make a motion?
Yes, I will make a motion to accept the meeting minutes from our last Board of Health meeting it was in July, correct?
Correct.
Yes.
And I'll second out of necessity. Amy, yes.
Beth, yes.
Steve, yes.
One
Nope.
abstained.
Steve, can you?
Abstain.
Steve abstain. Yeah, because you weren't at the meeting to approve the minutes. Great.
I'll go over that later.
Yeah, there's a great course that the state offers for Board of Health members, and it's virtual now, so I would highly recommend. I'm sure someone will recommend at some point that you take that. It will go over a lot of the legal requirements. But at this point, introduction of our new Board of Health member.
Thank you for having me, everybody, and I look forward to working with everyone and doing the best we can for our town and our citizens over at Easthampton.
Great. Well, we're so glad to have you. We've been down a Board of Health member for a while now, it feels. So it's nice to be back up to full capacity. Do you want to, Steve, tell us a little bit of your history, your work history, and why the Board of Health seemed like a good choice for you?
Sure. I went to nursing school at Springfield Technical Community College. Then I worked at Bay State for a number of years in the emergency room. Also in the cardiac surgery department. Did some travel nursing after that. Came back to work at Cooley Dickinson. And then me and my wife moved out west to work with the Apache Native Americans for about 3.5 years. Came back to Easthampton and I was offered a job in a different space. So I currently work in the pharmaceutical industry. We work in the fill finish manufacturing. So many injectable drugs, things of that nature. Overlook helps package those materials. And I want to join the Board of Health to help the people of my community.
That's great. That's great. So I'll go ahead and introduce myself to you since this will be your first meeting, and then Beth, you can do the same. So I have been on the Board of Health now. I think it's been like 5 or 6 years. It's been, time flies. No, it has to be 5 because Everett was just born. Been on the Board of Health for 5 years. I spent about 12 years in local public health, 2 primary stints. In between those 2 stints, I worked for a consulting firm and traveled up and down the East Coast doing brand audits and food safety audits. Very different than inspections, but similar process. 3 years ago, I started at the Department of Public Health, working in the Office of Local and Regional Health, helping to support local health departments across all 351 communities. My primary projects are just helping to set the standards for local boards of health across the state, also to develop the first ever integrated data system for local public health so people can access their data, cross-reference and analyze it with state and national data sources to get a better idea of what's happening in their community so policies and programs can be targeted towards the needs of each community versus, larger picture things. So it's great to have you, Steve.
Thank you.
Beth?
Hi, Steve. My name is Beth Rest. I've been on the Board of Health for 3 years now? I think I'm starting my 3rd year, something like that. I grew up in Easthampton, moved there when I was a month old. So I have, my father was involved in Easthampton in the city council since there was a city council. So I wanted to be involved in some way. I'm a physician assistant. I won't go through my work history because it will take us all night, but I'm currently working at Bay State in GYN oncology and GYN robotic surgery.
Wow.
But yeah, I'm sure I can speak for both of Amy and I that we're very happy to have another Board of Health member on our team.
Thank you.
All right. Next item on the agenda is the health agent update. All right, Brian. When did you start back?
So it's a week today. So
Okay.
I came back today.
So a full 7 days where you could have sent us pictures or, given us any of the good stuff about your leave, but maybe soon.
Oh yeah, definitely. And I know Jackie's got a ton too. I've been sending her a bunch. Like I said, I've only been here for a week, so I don't have too much to update you on. I sat down with Dennis the day I got back. He updated me on some things that he has that are currently ongoing that he started while I was out on leave. So just a quick recap with what I have on the report. Food. I know that I stated right before I took my leave that Big E's was compiling their HACCP plan for the reduced oxygen packaging. I actually got a copy of that HACCP plan today. So,
Perfect timing.
Yeah, so I'm going to begin to take a look at it by next week. And then I was hoping to get it on next month's agenda, but it's probably going to be for November, just because of the owners and the managers' availability. They're out of town during the October meeting.
Do they need to be here?
I guess they don't need to be here, I guess, no. But I think Judy from oh, sorry, I was just gonna say Judy from Big E's. I know that she requested to be present. I'm not sure if it's required on her end now.
Well, you could let them know that if they want to get approval, we can certainly take it on our October meeting. If there are any questions or concerns that we have, we can also have them come back to the October meeting. But if they want us to if you're fine with it, we can certainly take a look at it. Brian, have you reviewed HACCP plans without Bree before?
No, I have not. No.
Okay. How do you feel about it?
I probably, could get a little bit more educated on it. I know the basic requirements of, I know, you know, I think I know the gist of what to look for, but I think I'm not as extensively trained on HACCP as I should be. I know that I eventually would love to take a HACCP course, and get like more educated on that.
Then shared service arrangement might be able to help support that. If not,
Sure.
Bree as our regional trainer up in Greenfield, that's within her jurisdiction to help support. So she might be able to offer that some support with walking you through this approval process, and then so you can
Okay.
take notes and be ready to go for the next one.
Okay, that sounds good. Yeah, I have a open line of communication with her, so I reached out to her the day I got back with questions.
Great.
She's very helpful and very useful, and she gets back to me very quickly, which is very helpful.
Unfortunately,
it's
great for a trainer, but it was bad for us, good for everybody else, I guess.
Yeah. So I'll reach out to Northampton or Bree to see if I can get some help on reviewing that. And then if everything looks good, we'll put it on the October agenda, and I'll let Big E's know that they don't need to be present, and that if everything looks good, hopefully it'll be approved next month. For food, so Northampton's regional inspectors, so they are still continuing to assist with routine and temporary food events. I do plan to get out there and do more field inspections with food once I kind of get my feet on the ground after my leave. There's quite a lot of housing that Dennis had over the summer that he still has open, and last week, just when I came back, I had 3 more housing cases that came my way. So that's what's been taking up my time. But I think it's important for me to get out there. Although I know Northampton's regional inspectors, they're very useful. I just think it's good for me for my presence to be out there. To get out there and let people know that I'm still the health agent, and because I know it can get a little confusing with them when they see unfamiliar faces. And then, like I said, housing, there's approximately about 10 open housing cases.
Mm-hmm.
Working closely with Liz on several of them that involve hoarding and unsanitary living conditions. Dennis tied her into some cases before I started, and we had some open cases prior to my leave too that we're still currently working on. There's one that's on the verge of going to court, but we had somebody reach out to us today that might help us avoid that scenario. So it's a hoarding case that's been open for quite some time. So that's it for housing. And then just in general, I was awarded a scholarship for the registered sanitarian online prep course. So I plan to begin that actually next week. So with hopes of getting my certification sometime early next year, if possible. So I got that going on. I'll be communicating with Lindsay from the mayor's office and Emily at HR in regards to they'll be allowing me to work remotely the days that I will be working on this prep course to put my full focus on it. That's pretty much it. I have that's pretty much all I have for my update since I've only been here for about a week now. So. If anybody has questions or.
Great. Well, welcome back, and thanks for your update. It says I'm getting a notice that my internet is unstable, so I apologize if I'm cutting in and out. But Brian, thanks for the update, and welcome back. is the social services
Hi guys. Steve, welcome to our board. Thanks for joining us.
update.
When I'm
Thank
not
you.
in Easthampton, I am working in the Bay State ER.
So Liz,
Full appreciation for your time there. So I don't know if anybody has any questions on the update. We had a bunch of outreach stuff in August. I was out for July. I came back from leave August 5th. The big things for August, we did the overdose awareness vigil, which was great. It's the third year now that we've done it. The first year when it was just me and Bridget, there was about 4 of us that showed up, and we had a pretty great turnout this year. A lot of vendors, the weather cooperated. So we ended up with like 80 people. We had Senator Vila spoke, City Council President Gomez spoke. We had 2 local family members who lost loved ones. So it was a really nice night. We got great feedback from people. So it was a pretty solid all around. Tapestry is great. Their mobile van is booked and busy. We're talking about some other things that they can offer in town for their mobile van services. So that's working out nicely. And then the Veterans Coalition that I am one of the chairs on, we did the big community event at Nonotuck in July for local veteran families, which was great. September is already super busy. Brian and I are booked with housing cases. Kids are back in school, so I have a lot of family requests. And I think that's it. So I'll keep it short and sweet because I know we got a lot to cover. Thanks.
great. Liz, I have a question.
Sure.
Is there any data around how many more people the Tapestry van has been able to see since we started that contract with them? Like the increase in touch points?
I can certainly check in with them. They were vendors at the vigil, and we had a conversation with the mayor and some of the other city leaders that came through just about different places in town where they would like to be setting up. They wanted to set up in the plaza across from 7-Eleven with all the shops in there, but we haven't heard back from the owners of the lot. So we were talking about just like doing some outreach on the bike path. They've been at Millside, they've been at the community center. So they've been giving out a ton of stuff, and they're looking to, continue to expand that. So I can reach out to Katie, who's our contact, and just see what that's looking like. And just see if we can get, either quarterly or like periodic updates. I'm sure they'd be happy to provide it. They're like very well received in Easthampton so far.
Yeah, and I'm sure for their stuff they track that information.
I know.
I just think when it comes to budget time, if we could show like prior to having a contract, how many people they were able to see, and then now that they have their contract, how much that has increased, and like maybe a breadth of scope of like how many, what they're helping support our residents with, would probably be a good way to validate continuing those efforts or justify.
Yeah, I know there's some language in their contract and in the shelter contract we did just around data collection. So I'm sure at some point they're submitting stuff to the mayor's office, but I can check with Lindsay and Katie and see what the dates were that were agreed on that, and get a report at some point.
Thank you. And I know there was some questions at one point on trainings. Did that all get worked out, Liz?
No, but we're talking about it.
Okay. All right. It's an agenda item?
No, we, as in like me and Lindsay and Jackie, are continuing to work on these things.
Okay. So it's being discussed. We're okay.
Yep.
Good. Because at one point I thought it was going to be an agenda item. But as long as.
Oh, I think it was, but Lindsay couldn't be here, and there was just, the conversation's been ongoing, so we'll figure it out. But thank you.
Yeah, of course. Great. Okay. Who's next? Nurse update. All right.
Okay. So I have 3 flu and COVID shot vaccine clinics booked. I have the city employees is going to be on October 2nd from 2 to 4. The Council on Aging is going to be October 11th, 1 to 4. And that one's totally booked already. And the community vaccine clinic is going to be November 6th from 3:30 to 6 p.m.
Is there a reason why it's so late?
Just to get people that are working.
No, not late in the day, late in the season.
That's what they had available, and I had to book the room it's going to be at Mountain View School.
So it's a location booking issue, not a nurses booking issue?
I think probably both, because that's one of the dates that Northampton gave me. And I gave the principal where I had to apply for the room. I gave him the dates, gave him 4 different dates, and that's the date that they gave me.
Okay. Usually in the past, we've done it at the fire department in like a EDS style drive-through.
Right. Northampton is not doing those anymore. That is starting this year because they started doing that during COVID. And they found the day that we did it in Easthampton, it was raining and people were slipping on the grass and people were backing up, and they felt that there were safety concerns. They are not doing it in Northampton either. They're going to have it at Smith Vocational this year.
Okay.
It seems like they're streamlining a lot this year. They didn't have like Saturday openings either for me.
And when will registrations open and how will they open for the November 6th clinic?
The flyer is going to be out tomorrow. I'll have it, and then I will send it out. I will post it. It will be. I'll try to get it on the safety website and just get it around town too at various sites.
Okay. And what if all those spots fill up? Do we have a plan to hold a secondary one?
I don't know. These are they offered me 3 right now. I can check into it though.
Okay. I mean, I don't know if they will fill up because it's later in the season than typically people like to get their flu shot, but it might be good to talk to them about if they do fill up, can they hold a date for you now in early November? And one last question for you, Christine. Sorry. Are pediatrics allowed at this clinic? Like, if people are watching this video, who knows?
Yes.
I hope people watch it, but
yes, 6 months and older.
Okay. And can people access just the flu or just COVID vaccine, or is it a combo shot?
Yes. No, it's not a combo shot.
Okay. I think that's all the questions people might want to know. So thank you. I'm sure it feels like you're on the hot seat.
And it just didn't. They haven't received their vaccine yet, as far as I know. They hadn't at the last few days. So, and that should be coming in sometime this month.
Okay. Well, thank you, Christine.
Anything else, or?
That's it.
All right. Thank
All
you.
right. You're welcome. We'll move to the Healthy Youth update. So Hunter.
Hello.
Hi.
Yeah, I don't have much to update. Technically my position's going to be ending on September 26th, so it's kind of just like the closeout of everything. That's what's been going on. I know I have the coalition 10-year gathering this Thursday, and then next week I'm going to be working on just the remainder of the grant. There's a few different pieces of paperwork I have to do for the closeout. Yeah, other than that, I just wanted to float the tobacco-free generation policy, that's our nicotine-free generation policy that's been popping up on the other side of the state recently. And the Massachusetts Supreme Court did give it an okay in the public health perspective. I just know Chris brought to my attention she had stopped at a gas station, and they have little pamphlets at Cumberland Farms now, warning people that this change is coming and not to support it. So just I'm going to be gone. I just wanted to float this to you guys. Hopefully it's a change that, somebody picks up and runs with, because I would love to see that in our community and more communities around. So
Is it like a regulation or like a pledge?
it's a regulation. So cities are passing their own, like, or health boards are passing their own regulations that phases out tobacco sales to like anybody after a certain strict date that doesn't change. So like anybody, say if we put this into effect tomorrow, anybody born 21 years ago tomorrow, or sorry, my brain isn't working. The whole idea is it just phases out the ability of people to buy tobacco if they're born after a certain hard date. So rather than the date on tobacco sales changing to match up with 21 years old, it's actually just a date that stays the same. So if someone's 20 now, but we pass this law, say tomorrow, and they turn 22 or 21, they won't be able to buy tobacco products in our community still. So that's, yeah, it's doesn't hurt like people who are already. Yeah, there's like 5 or 6 different communities in Massachusetts right now that have like passed it. Like I think Brockton, Needham, I think was looking into it, or they may have Wakefield. And there was like issues because there was that pushback from gas stations, convenience stores saying that it's not legal for communities to do that, but the Massachusetts Supreme Court as in April, I think, ruled in favor of communities passing these kind of ordinances or regulations, with the ultimate goal of, it doesn't hurt people who already smoke cigarettes or other products, but it stops people from starting to smoke cigarettes. So,
interesting. I'm curious to see where that goes.
Yeah, I sent you an email, I think, last month regarding that.
Oh, I'm sorry.
Which, I understand everybody's busy and everything like that.
Yeah.
But just wanted to get that on the board.
Thank you. Hunter, we're really grateful for all the work that you've done for our residents. I hope we were able to figure out a grant for you in the area soon, or some mechanism, because I think you've done a lot of great work for the Healthy Youth Coalition and to support Easthampton residents. So thank you for that. And if there's anything I can do, I know MAHB, there's lots of other statewide organizations who might be looking for people. So if there's anything that you're looking at that I might be able to help, feel free to reach out. Good. All right. The next item on the agenda is a septic hearing for 48 Clapp Street for a denial of a permit. So, Steve, when we have hearings, we have to suspend our regular meeting, open the public hearing, hear the public hearing, and then close the public hearing. So, Beth, you want to make a motion?
Yeah, I'll make a motion to suspend our Board of Health meeting and begin the the hearing for, is it 42 Clapp Street?
48 Clapp Street.
Sorry, 48 Clapp Street.
I'll second the motion.
All in favor?
Beth, yes.
Steve, yes.
Amy, yes. All right. Dennis, why don't you kick us off?
Hi, everyone. Boy, small world, huh, Amy? Time does fly. I believe that Bacon Wilson, you have their opinion in front of you, or have you received it? I met with the attorney, Mr. Turner, Mark Turner, because this involves a lot of different issues. And I believe he gave you a synopsis on, am I allowed to do what I did? I think it's right there. Do you have it in front of you?
Jackie, did we get that?
I sent it to Steve and Beth because Dennis thought that Lindsay should have sent it to you. I can send it to you now.
Okay. Yeah, I
would you like me to read it?
Oh,
I received it, but I haven't had a chance to read it yet.
Yeah, Dennis, go
Okay.
ahead. Why don't you read it for the record?
All right, then. This was written on September 4th. There were two of them, but this is a revised one. This is on September 4th. This comes from Mark Tanner, City Solicitor, 48 Clapp Street, Easthampton, Mass. is the subject. On September 3rd, 2024, I met with Dennis LaCourse, Acting Health Inspector for the City of Easthampton, regarding the property at 48 Clapp Street. The property, that's the property. It is my understanding from speaking with Mr. LaCourse that the owner of the property initially applied for a permit for the repair of an existing septic system, which had failed, and that Mr. LaCourse denied the application. It is my further understanding from speaking with Mr. LaCourse, and as reflected in James A. Gracious P.E.'s letter of August 16, 2024, which I have a copy of here, and I believe you probably have that too, appealing the denial, that the septic system at the property was designed for 3 bedrooms and that the house on the property had been expanded to include a 4th bedroom, and that a garage on the property also contains an apartment with a kitchen, bathroom, and bedroom. Given this information, the property requires a septic system capable of serving 5 bedrooms. In denying the initial application, Mr. LaCourse cited 310 CMR 15.204, which states, no person shall increase the actual design flow to any cesspool or to any other system above the existing approved capacity, which in this case was 3 bedrooms, or change the type of establishment of a facility served by a cesspool unless the cesspool or system is upgraded first. Upgrades to accept increased design flow shall be performed in full compliance with the requirements applicable to new construction unless a variance is allowed pursuant to 310 CMR 15.414 for the purpose of 310 CMR. And then
I think that's good for now. Why don't we give Mr. Gracia? I assume, Mr. Gracia, you're here for this hearing. Oh, you're on mute.
You should probably hear the last paragraph.
I read it, so I think,
okay.
Yep.
You're still on mute.
Oh, there we go. Okay. Want to read that last paragraph? Because I haven't seen that letter.
Oh, sure. It's all public record. The last paragraph, it says, actually, we'll just read the whole thing. Dennis, why don't you just finish?
Okay, I believe Mr. LaCourse is correct in applying 310 CMR 15.204 to this situation, since the application seeks to increase the size of the existing system. The issue before the Board of Health is whether the Board of Health should grant the applicant a variance from the strict requirements of CMR. It is my understanding and acknowledged by both Mr. LaCourse and Mr. Gracia that compliance with the current CMR requires an additional perk test and 2 additional test pits. The appeal does not specifically ask for a variance. In other words, Mr. Gracia didn't actually ask for a variance, but instead argues that the cost-benefit analysis of these additional tests weighs is sufficient to grant the applicant relief he seeks. The Board of Health, in its discretion, may treat the appeal as a request for a variance, should it choose to do so. I note, however, that no applicant is entitled to a variance as a matter of law, and that variances should be granted sparingly and only where the applicant satisfies each of the criteria found at 310 CMR 15.414. During my subsequent conversation with Mr. LaCourse, I was informed that the additional bedroom in the basement of the existing home on the property was constructed without permits or inspections from the city. I was also informed that the apartment in the garage was originally constructed as an office, which was later converted to an apartment, that both the office and the garage, office/apartment, were constructed without permits from the city. It is therefore not clear to me that the work for either the bedroom or the garage above the apartment was done in compliance with the Massachusetts State Building Code. Given this concern, I believe the Board of Health would be justified in critically examining the variance application, given the property's history of clear code violations. I have copied the building commissioner on this memo so that the apartment may take any acts it deems appropriate. If you have any questions, please feel free to contact me, mtanner@baconwilson.com.
All right. Thanks, Dennis. All right, Mr. How do I want to pronounce your last name properly? Gracia?
Close enough.
Okay.
Gracia.
Gracia. Thank you. So I think the board would love to hear your thoughts and viewpoint on this situation.
Well, as I mentioned in my letter, there's no denying that Mr. Pierce, he's dead now, did some things without the proper permits, going through the proper procedures, and there's no argument there. He did all these things. And even the way he connected the sewer from the garage to the existing septic tank, never should have been done that way. However, that's 15 years ago. This is not new construction. It's been, whether you want to argue about the building permit and all that stuff, that gets another subject altogether. I'm trying to get the septic system built and constructed by the code and make it meet all the requirements of Title V. And to go back, to force us to go back out there and two more test bits and another perk test, which is not going to yield any new information. Granted, Title V requires it. If you think that this is new construction, it wasn't new construction when we went out there 2 months ago to do the perk test. This had happened 17 years ago when he actually built the garage. He put in a room over the garage, and he was using it in an office. Then he decided to make an apartment out of it, and that's ancient history. I mean, what are you going to do? Beat a dead horse over this? Let us finish this septic system and do it properly. If you want to fight over the building permit of the garage, that's another issue altogether.
Well, so
I just want to get this thing installed. So this poor widow who lives in Florida, she's not even up here. She wasn't even married to this guy when he built this stuff. She's the one stuck with this piece of property. She's got to maintain it, and she's got to pay the taxes on it and all that stuff. And she's trying to sell it and get out from under it. So I just want you to be practical about this. What are we going to accomplish by going back out there and doing 2 more test bits and a perk test now? Why didn't Dennis say we needed to do 4 test bits and 2 perk tests when we were out there in July? He knew about this apartment.
Well, I mean, so I can't speak to that, but just so am I correct in understanding, Dennis, that the plans that he submitted for the repair would not be built and designed for 5 bedrooms?
No, you're incorrect. I'll comment on this. The reason for the second set of perk tests and depots is establish a reserve area. When you do a repair, you only do 2 depots and 1 perk test so that you can repair that system, but you don't establish a reserve area. And, going on for this, there's a lot more to this. I mean, the Pierces, and I say the Pierces, both the Pierces, they ignored all the rules and regulations from day one. I was involved in this in the very beginning. I met with the Pierces back when they were building the garage, And he requested at that time to connect to the sewer system. And I told him at that time it was required. So he said, okay, and I left. Well, after I left, they proceeded to build an office and then build an apartment. And when they built the apartment, they went in to build another bedroom in the cellar. So now he can have his office in the cellar and rent out the apartment. And for the last number of years, whatever it may be, they've been enjoying the income from that apartment. So this is not a case where they didn't get the income. This is not a hardship as far as income. So they have chose, and I say they because they were both aware of it, they have chose to ignore every single rule and regulation. Building permits, Title V permits, never obtained permits from the Board of Health to connect to the existing septic system. And now they want the board to rubber stamp, or she wants the board to rubber stamp to build a new septic system so she can now sell that property with an apartment. Not one aspect of that apartment is legal.
So Dennis, when you were out there and you told them they needed to connect to city sewer, was that this summer?
It's not city sewer. I told them, Jim, you do remember that I did bring up the issue of the 2 depots and 2 perk tests. And you indicated.
Not while we were out there doing them. You never said a damn word. Excuse my French.
Okay, so what happened on site? I'm trying to understand the facts so we can help explain this to the rest of our board members in a clearly understandable way, because both of these guys don't have their septic installers or soil evaluators license. So Dennis, when you've worked for Easthampton in the past, I'm trying to understand if this conversation was one where was had this summer or during your last employment here.
Both times.
Both times. So when you worked here previously, that's when the conversation was had about what was necessary. And I thought you said you told them they needed to connect to city sewer, but that isn't what you said?
No, because there's no sewer out there. I told them that he needed to upgrade his septic system because he was increasing the flow under the same regulation pertains now if he wanted to put an apartment in there or a bathroom in that office. And he went, yeah. And then I left because he didn't indicate he wanted to do that.
Right.
And after I left, he went ahead and did it. So now the system's in failure. I went out to witness a perk test with Mr. Gracia. And at that time, Mr. Gracia did inform me that there was another bedroom in the cellar and that there was an apartment above the garage. Well, Mr. Gracia knows that when you increase the flow, you need to do 2 perk tests and 4 depots. I didn't feel I needed to educate him on that. He is an engineer. He is the former city engineer.
Yeah, after I turned the plan on, you all of a sudden now you want 4 depots and 2 perk tests? We were out there for 3 hours out there. You could have said it that day. Now I got to come back with a backhoe and cost this woman another $1,200. This is baloney.
How much it costs is not something the board really worries about. Our job is to ensure that the code is being enforced, that the environment is being protected, and that the future owners of this house have a system that isn't going to fail for them when they move in a couple years because it isn't designed with the appropriate codes in place, right? That's our job. How much it costs is not something that we worry about. Dennis, is the system plans that you've been provided compliant with size for 5 bedrooms?
Yes.
And what you're saying is you're saying an overflow, what's it called? Reserve area. The reserve area.
Reserve area. There is no reserve area. What I'm saying is that the regulation is very clear, and I'm not empowered to change that regulation, and you're the only ones that can grant a variance. But I'm also saying that that apartment does not meet the housing code. It's not in compliance with the housing code. It's not in compliance with the Board of Health regulations as been previously permitted. So Mr. Gracia is asking me to approve something that the regulations clearly say I can't.
Did you do?
And the city attorney agreed with it.
I mean, I think it's hard to say here that the apartment isn't in compliance with the housing code unless you did a housing inspection on that. Did you?
You don't need to because it was never permanent. In order to have an apartment in the housing code, you need to have had all the permits and be in compliance with the building codes. The apartment is not. Even the city attorney even agreed with me.
Well, the city attorney agreed that the proper permits were never pulled to make it an apartment. That I think is all that the furthest that I'm willing to go here. But all of that is not what we're here to hear a variance for. The variance that is before the board. So we're here to talk about the code asks, okay, when you site a septic system, you have to evaluate the soil that the system is going into. Correct. The flow is based on the type of soil that is in the ground. Lots of sand and or loam, you're getting two different perk rates, which means the effluent that comes out of the septic system goes fast through the soil and can then impact the groundwater. So you do a soil evaluation to check what that soil is to make sure the groundwater is protected. During a repair, you need two perk holes. And basically what that is, you dig two holes, you check the different horizons of the soil to see where you need to put the soil on the vertical and how big it needs to be on the horizontal. When you're doing a new construction, or you're changing the size of the existing system, what Dennis is saying is you need 4 holes and a reserve. The installer is here talking about asking for a variance at this point because he's already completed his perk test. He's asking for a variance on needing to do the additional 2 deep holes in the reserve area because it wasn't done at the time of the initial perk test. Gentlemen, do we all agree that those are the facts?
That's what I'm asking, yes. Waive the 2 additional deep holes and the additional perk test. Yes.
Okay.
Well, my only comment, and again, the city attorney commented on it, was whenever you increase the flow, you have to meet new construction standards.
Okay.
Standard. And that's what I was hanging my hat on.
Okay. So, guys, what Dennis is saying is when you increase the number of bedrooms, the Title V code is based on the number of bedrooms because you can assume that the bedrooms are occupied. So the flow rate is designed based on the number of bedrooms, not the number of people. People change, bedrooms don't. So what Dennis is saying, anytime you increase the flow, and that's by adding the 2 bedrooms, you're supposed to then meet the new construction expectations or requirements. So for my Board of Health members, are there any questions that you guys have for either party here?
Is the designs for the repair adequate for the 5 bedrooms?
Yes.
And will it be on the same footprint?
We're going beyond the existing system in the ground. In other words, we're not going to dig the old system out. We're just going further away from the house.
You going towards the street or towards the river?
No, further back on the lot.
Okay. That's all my questions.
Beth?
No, I don't have questions. You explained it pretty well. I think I have a grasp of what is going on.
Okay.
I mean,
so then if there are no questions for either party and everyone feels like they've had an opportunity to talk to us, the next step is for us to close the hearing and then for us to deliberate on what we want to do as a board and make a motion on that. So if this is the time to have any questions or discussions with these folks. So if we're good with that, then I'll entertain a motion to close the hearing.
I'll second the motion.
But you have to make it. I'm entertaining it. You'll get this, Steve. Go ahead, make the motion.
I make the motion to close the hearing for the septic system on 48 Clapp Street.
Great.
I will second that motion.
Great. All in favor? Amy, yes.
Beth, yes.
Steve, yes.
Okay. So does anyone want to start with their initial thoughts on whether we grant the variance for the additional perk holes?
I mean, my feeling after listening to everything is that you know, I'm not inclined to go against the code and, you know, everything that Dennis explained. To me, it seems like they should have to be in compliance.
I mean, I think at this point we'd be going against code and we'd be going against our attorney's recommendation. So it's two pieces here.
Yeah. Agreed.
Steve?
I think we can obviously feel bad for the widow. With this property being so close to the river, it does concern me that we just have to do it the right way. And unfortunately, being a property owner incurs expenses every year, but I feel like it's the right move to stick with the code in this situation.
Okay, so would anyone like to make a motion on what they think our response should be to the request for?
Sorry. Yeah, I'd like to make a motion to deny the request for a variance for the septic system at 48 Clap Street.
I'll second.
And all in favor?
Beth, yes.
Steve, yes.
Amy, yes. All right. Thank you.
In writing, please.
I'm sorry?
Can you put that in writing to me?
Sure. So Jackie, yep, Jackie can get you both a copy of the letter from the attorney, because it sounds like you didn't get that, and a copy of our meeting minutes, which will be in draft form because they'll be before we can vote on approving them next month, but they'll stand. She'll get you a copy of the minutes and a copy of the attorney's recommendation. Dennis, is Jackie sitting next to you?
Yes.
Okay, great. Jackie, heard?
Yes.
Great. Mr. Grassi, would you like those in email, or would you like to pick them up at the Board of Health office?
I can pick them up.
Okay. Jackie, when's the next time you're in the office?
I'm not working tomorrow, so they won't be available until at least Monday, because Thursday is my first day back to work.
Okay.
So I'll have to do the work on Thursday. I can have them available on Monday.
Okay, so let's
work on Friday.
Plan on Monday, and then Jackie, if there's a delay for whatever reason, because we all know emergencies pop up, if you could just let Mr. Garcia know so he doesn't make an unnecessary trip.
Yep.
Great. All right. Let me see. I think that was the last item on our agenda, but let me pull up the agenda just to make sure. Meeting materials. That's it. Unless anyone has any items that were not anticipated at the setting of the agenda, that is the end of our official agenda.
Could I comment on this?
On the hearing?
Not on the on what you just ruled. That's over with. The appeal is over with. One of the things the attorney talked to me about is if Mr. Gracia moves forward and does what he's going to do, the 2 perk tests and 2 depots, and builds this system, the health inspector, and you can talk to the attorney about this, cannot issue a certificate of compliance to the new system because it doesn't meet the requirements of a certificate of compliance under the housing codes and the building codes. So I honestly think that Mr. Gracia should be told that one of the possibilities that could be, and I know this is not the best thing in the world, but it's the reality of it, is that the board could issue an order after he does an inspection of that apartment that that apartment be vacated until such time as they bring it into full compliance with the building and housing codes. So that discussion came up with the city attorney.
So I certainly, well, I mean, has anyone talked to the building inspector? Are they going to go do a building inspection?
He's not got it scheduled, but he would go with Brian if he had to go.
Well, I think we certainly need to make this clear to the homeowner. I don't think we need to explain this to the septic installer. We need to explain this to the homeowner.
Yeah.
And so, Brian, what I'd love if you could get with the building inspector and the attorney and draft a letter prior to scheduling the next 2 deep holes, because if they, I mean, we're not going to make a decision as a board, I think. I mean, I'll speak for myself, that eliminates people's ability to live it or sell their home. Our job really is to make sure the home is safe for any tenants that are in there at part of the housing code, and to make sure the environment is safe by building a proper size septic system. Most likely it failed because there was too much flow demand on it, right? Like, I didn't ask why it failed, but I assumed that is why it failed. So I want to I prefer, as a Board of Health member, one of 3 voices, I want to make sure we're giving them all of the information, but we're also not an obstacle to doing the things that they want to do within their home.
Yeah, I agree.
I agree as well.
So, Brian, if you could get with the building inspector and our attorney and find out what the best way to approach this is, because the last thing I want to do is have them do their 2 deep holes, and then you or the building inspector go in there and say, we're not going to approve you for a 5-bedroom design because what you have is an illegal bedroom that isn't in compliance with these 2 codes. Because that would rightfully so piss some people off. So before we schedule the deep holes, and Dennis, I assume you're still doing our septic? Yes. So before we schedule the deep holes, let's make sure we get that information from the.
That's why I brought this up, so that you'd have the opportunity to do that. Okay.
Yeah.
Yeah. No, absolutely. Tomorrow I'll reach out to both. Get that started.
Great. Board, does that sound good to everybody?
Yes. Yes.
Thank you for working with you guys. And
well, it sounds like we're going to see you more if you're doing our septic. So this isn't a
no, I'm all done with Easthampton. I said that 13 years ago. It didn't work then. I hope it does now.
Well, you're going to finish this septic, right?
No, Brian can witness the perk test. But that brings up another issue. Brian, are you a soil evaluator?
Not yet.
It has to be you, especially if they're going to ask for a local upgrade approval.
Right.
So it's not a swan song. We'll see you next month.
Yeah, he can't grant it, right? Because he's not a soil evaluator. Okay, you win.
All right.
We appreciate you, Dennis.
We'll see ya.
Yeah.
Take care, Liz. We had some fun. We got some things accomplished.
All right. Would anyone like to make a motion to end the meeting?
I will make a motion to end today's Board of Health meeting at 6:30 p.m.
I'll second that motion.
All in favor? Amy, yes.
Steve, yes.
Beth, yes.
Thank you all.
All right. That closes your official first meeting, Steve.
This government meeting is brought to you by Eastworks and our local cable subscribers.